Good morning. I hope you guys are all having a great time. I'm learning a ton. I was talking to someone, another colleague, Dr. Fatima, who also has a private practice in Schaumburg, and we were discussing the great part of this, that as private practitioners, we get delved into what we do, and that we don't have a lot of time to share that camaraderie. And so I think that this is a great opportunity to do that. And I've been meeting a lot of you and learning a lot from you, and seeing that we're really all very synergistically having a similar mission, and we can collaborate really well. So I'm excited about following up with you guys. So having said that, I'm here to talk to you about the pathway to the mind. Ideally, what I want to do is I want you to fall in love with your eyes again. I want you to realize the value that your vision has in your life and in your brain and in your overall health as well, so that you do not take it for granted. So, having said that, another thing I want you to learn from today is that I really want you to break away from that misperception, that false narrative that you've been led to believe that because you have 20/20 sight, everything is fine with your vision. And in reality, so what you guys are more commonly familiar with when you think of the eye doctor, you think, oh, I see clearly, I don't need to have my eyes checked. Well, in reality, you need to have your eye health checked. And so what's a little bit unique about what I do is I do see all patients. So someone asked me in the audience earlier, do you see adults? And I said, well, if you have a brain, I see you. Because what I do is I help your brain develop faster, stronger, but through the visual system. And so that's a little bit unique from what you're more commonly aware of, or what you're used to thinking, because you see so much commercialism and so much social media about, you can, get your eyes, you don't even need to have your eyes checked, just get your contact lenses. And so you really need to go away from that philosophy that just having 20/20 vision, everything is fine. Before the end of the day, or before the end of my presentation, I want you to know that your vision plays a huge, more independent role in that. And so I work more with the eye-brain connection. And that's what I want you to walk away from today. So I do see a lot of patients that not a lot of other doctors have an opportunity to see, but it doesn't mean, and you'll see all these conditions here, traumatic brain injury, concussions, autism, dyslexia, learning disabilities, all of these children I work with, all of these profiles I work with, but it doesn't mean that you have to have that in order for me to see you. I can still help you do better. And so here's one of the examples I want to show you, the difference between sight and vision. So sight is just a process or an act that your eye does. So you can see in this picture here on the left, hopefully you can see it clearly. And then here, this one on the right, you can hopefully see it blurry. So the eye can just detect, is this image clear or is it blurry? Vision, on the other hand, is a process that needs to happen in the brain. And the way it happens is the information from the eye is then transmitted to your brain, and then your brain learns how to use it. So with the example that Julie was giving us earlier, her baby is seeing through every day, seeing through new eyes. And the reason for that is true, because I keep going ahead of myself. The reason for that is because the role of your vision is to help your brain become faster, stronger, more precise. So it teaches your brain to learn. And so vision is a learned behavior. And so the more that you explore, the more that you become smarter, the more that you do things more precisely and more accurately. So like, for example, I'm showing you this picture again, and then if you didn't know that these were coffee beans, if you had never seen a coffee bean, you would never have known that's a coffee bean. And then at the same time, if you didn't know what a man was, you wouldn't have known, okay, here's the head of a man within the field of all the coffee beans. And so that's the part, the processing, the giving meaning to sight is what vision is. So I'm more of we work with vision. And so because of what our previous speaker had said, let's begin at the end. And at the end, what we want to do is we all want to be our best. We all want to do are things, whatever it is that we want to do, whether it's at school, whether it's at work, whether it's at a sport, we want to be our best and stress-free. And so the reason that that this is important is a major study came out of MIT letting us know that the best performing brains are those that the neurons communicate with each other. And in this particular study, what they did was they looked at elite professional athlete brains, they compared them to professional athlete brains, and then they compared them to just everyday people like us brains. And they said, what's the key factor that makes these elite professional athlete brains perform better than non-elite professional athlete brains? And the big thing that they found out is that it's the network of neurons that communicate with each other within the brain in a very rhythmic, harmonizing manner. And so that is what we talk about when the brain performs. And so, again, to talk about the brain performance, you can really, really oversimplify it by breaking it down into the brain has to do three main things. It's got to take in information, it's got to process it, and then it's got to be able to execute it. And so the more that we do that, through that network of neurons communicating with each other, the faster that our brain will perform. And so what is, and that's not a typo, that was intentional, so that you will remember me. So I'm giving you a visual to connect with me. So I'm helping you have memory. So the reason that your visual system is so critical for the brain development is because 90% of the input into your brain goes through your visual pathways. So, and the reason that that happens that way is because the actual visual pathways that connect the eye to the brain are made up of the same exact tissues. So we call that neuroderm, as opposed to all the other senses are made out of external tissue, where the visual system has the neuroderm is the same exact tissue as the brain. So when we're talking about brain performance, we're really talking about visual performance. They're one and the same. And I don't want you to get overwhelmed by this picture. The whole point I wanted you to get across from here is that, going back to that example, that 90% of the brain's information goes in through the visual pathways. So it goes from the eye along the visual pathway, and then it goes into the processing center of the brain for vision. And then you can see in this whole image here that every other part of your brain here first has to get the signal from here. And so that's why visual input is so critical, not only to brain function, brain performance, but it's even, going back to Julie's point, it's critical for overall brain development. The more visual input you're getting, the more you're going to instigate the brain to explore and want to move, and then now the brain and the body learn to communicate with each other better and better. And then you learn to do all of these things so much, much better. So I personally, when I talk to my patients about the importance of their brain, I go as far and say, you need to think of your eye-brain pathway as your personal internet. And then when we talk about it that way, you get it, right? Because we can understand that, sorry, I don't know why I'm so like rushed. You can think that, I'm gonna start meditating. No, just kidding. But you can think about it, what happens to you when your internet is slow. You don't get a lot of work done. You have to try it over again. You now have to try, after trying it again, you're exhausted. And now it's the end of the day and you haven't done anything. And whether you're at school, you haven't learned. If you're at work, you haven't been productive. And then if you're an athlete, you just haven't gotten to win the game. So in our everyday lives, our internet is what allows us to browse through different applications. And I'm going to give you that visual that the better your internet system is, the better you're able to do softwares and projects, or the better that you're able to browse through different applications. And so you need to visualize behaviors that those are your applications as well. And the problem is we focus more on the problem with the application instead of focusing on the problem is with the underlying internet connection. So for example, with reading, we go, oh, well, I can't read fast enough. I must have dyslexia. So we're focusing on the symptom. Oh, I can't remember that. I must have dementia. It's because the information isn't coming in fast enough. It's not being retained. It's not being processed. It's not being retained. And so the same thing with other things. So we're so used to focusing on the symptom instead of the underlying cause. And we tend to try to treat what's going on. So this is becoming an even bigger problem today. So for me, that's job security. But for you, it's not so good. And the reason for that is because as we're becoming more and more mobile, we're also becoming less mobile. And so the point of that is that, remember, vision is the catalyst for your body to move, which then now allows your brain and your body to communicate better. You're more coordinated, you perform better. But especially with kids, we're seeing with a growing range of social and digital devices, kids are not moving anymore, right? So if I'm propelled to crawl, and crawling is a huge developmental milestone, because if I don't have a digital device here in front of me in my stroller, I'm more inclined to look at the birds, I'm more inclined to look at the cat walking across the room, and therefore I'm going to try to go catch that cat. So I'm going to go move. Well, that's not happening to these kids. These kids are not moving anymore every day, and you see it more and more, and so that is not allowing their brains to develop. And if their brains don't develop, they're not going to perform well. The same thing is happening in the school system, right? It used to be that high schoolers were the only ones who had Chromebooks in high school. Well, now I see it with middle school kids and even younger kids. And so these kids, they're not developing dexterity, they're not developing handwriting, and they're doing everything on their digital devices. And then the same thing with work, right? We're not moving, we're working on a computer all day long. And so aside from all of the other more detailed things, like the really core thing is our brains and our body need to communicate. Our visual system is that catalyst that helps them move. And so what we see then is in all these kids, if you're younger children, you're going to see that we have this growing epidemic of spectrum disorders, anxiety, sensory integration problems, and it really is your brain's not developing. They're not getting the movement, they're not getting the exposure. So then what's going to happen? We talked about earlier that, well, you're going to create anxiety. Well, of course you're going to create anxiety, because what happens is anxiety will become the byproduct, because if you know that you can perform, you're ready to take on anything that comes at you, right? But if you know you already gave it your best and it was still not enough, and now you have this other pile of load of work or schoolwork or whatever waiting for you to happen, that's constantly going to build out anxiety. So we see it with the kids. We see it with the school-age kids. The behaviors and the things that we're seeing is their homework takes a long time. They are not developing handwriting skills. They're becoming anxious. And by the same token, we're not allowing these brains to develop to their maximum level, while simultaneously we're demanding things at a greater efficiency at a much younger age. One of the things I really have a pet peeve about is kids used to have to read by 2nd grade. Now we get patients in our office who are failing kindergarten because they're expected to read, but their little brains didn't have the opportunity to do what they needed to do. And then the same thing happens with us as adults. We're now moving, so we have our brains. One thing that is good about us is that we're very good at accommodating ourselves to adapt to whatever it is our environment is, but that doesn't necessarily mean it's good. You know, if we're working in an environment where we're constantly like this, we get all of these neck aches and our posture, we're exhausted, we're exerting all of this extra energy, and so then we have all of these problems. And so one of the greatest things is that it used to be thought that, you know, your brain develops and then, you know, you reach a certain level of brain development, and then if that didn't happen, then you're it dies from there. And that's really a misnomer now. The greatest, probably one of the fastest growing fields in medicine right now is neuroscience, and it's because of the concept of neuroplasticity. And neuroplasticity talks about that the brain is trainable at any age. We used to think the brain was only trainable when you were a young child. And it is true, so it was so trainable only as a child that we used to call it the critical period, whereas now we call it the sensitive period, right? And it's because, yes, it's most trainable when you're a young child, and it's when it's the most malleable, but that's also bad because if they're getting the wrong input, they're going to have a greater negative effect on the long-term basis. And so by training your brain and training your visual system, which is the dominant input, we can improve our brains and we can improve our function. And so going back to that same example, that when we're talking about that brain performance, in order for you to develop that brain performance, 90% of your brain does develop in your first 5 years of age, but it doesn't mean that it's not going to continue to happen. And so a lot of mention has been talked about fight or flight and the parasympathetic and the sympathetic nervous system, and your visual input is directly tied to that. And so one of the things I was mentioning earlier was with the growing development of digital devices, and the digital devices becoming more high definition, and the blue light that they emit, they're constantly overstimulating the cells that feed into the sympathetic nervous system. And so that's constantly giving us, you're constantly training your brain on that anxiety mode, as opposed to, we used to have black and white TVs, now we're really deviating, but I could talk about forever about it. But the whole point here is that, yes, it's so critical that your brain develops in the right manner during your early years, and then matching up that is that brain development and that brain function matching up with what is currently being expected of you to perform. And that can always be improved. Just like how you can always be more fit, you can always be more healthy, the same thing can be said about your brain. So the big take home that I want you to do is that when we're talking about brain fitness, we have to talk about visual fitness. They're one and the same, and then always driven it to focus more on what's the underlying cause. And I think that's the general theme today, that we're all working towards looking at treating underlying causes instead of treating the symptom. And the same thing happens with your visual system, that it may not necessarily always be ADD because you're not paying attention. It just may be you have a slow processing visual system. And the bonus of that is the processing system can be improved. It can be caused to perform faster and faster, whereas something like ADD, you can only medicate or teach strategies for. So then what's the take home? The take home is that because your visual system and your brain are one and the same, and these are all, this is what I love about this slide. I'm talking about all of you. You guys talked about water and hydration, about eliminating toxins, and so really everything that everyone's talking about today are the things that you should do. And I always talk about what are my 5. I have a few more here. But my 5 are, yes, you have to sleep, and sleep is critical to your brain because think about it the same way with your phone, right? You charge your phone overnight so that the battery can charge up and it will last you the whole day. So sleep is the way you charge this battery. Hydration is critical because everything in your brain is electronically conducive. Water is an electricity conductor. Removing toxins. What you eat, foods that support, so we talked about the peptides and all of the supplements, all of those brain positive foods that are going to increase performance, and then exercise. And then the exercise, both visual as well as physical, because the brain needs to move. It needs to move, and we do all that. So, do you guys have any questions? Thank you so much.